has been a nurse with over 4 decades of renal experience, and she's a leader supporting professional collaborations and advanced renal research on a national and local level. She has multiple publications, and she is a preeminent nursing figure in national professional groups and is one of the past presidents of Renal Healthcare Association. Helen, welcome this morning. We're looking forward to hearing your presentation. And if I left anything out of your introduction, please feel free to jump in. You have quite an extensive resume.
Well, thank you very much. It's truly a privilege. I would invite the participants of this wonderful RSN Hope Week to ask questions either during the presentation or write them down, and then we can discuss it afterward. So the healthcare shortage, all hands on deck, what patients can do to help with the crisis. Well, we're going to start with the importance of routine care. You know, I would be remiss if I didn't, talk about what are we doing to take care of ourselves that is routine, whether it is regular checkups, taking your prescription medications. Managing your chronic illness can help you fight off other illnesses such as COVID-19 or the flu. The healthier you are, the more likely you are to recover quickly from an illness. Follow your dialysis prescription. And for routine visits, especially during these times, ask if you can talk with members of your care team by phone, email, or telehealth, like a video. Now, here's something that we don't think about often before it happens, but if you have a health emergency, such as injury, asthma, heart attack, or stroke, don't wait. Call 911. Quick responses can save your life. Know where ambulances come from, related to where you live. An example being is that you might be in a state where you can see the ambulance at the firehouse or at an ambulance center, but you are bound to, when you call, for it to come from your county, and that one might not be in your county. So be aware of that. It can be helpful. Be prepared. Ask your provider how best to prepare for a health emergency, just so that you know, as many clinics today are required to have really detailed preparation for emergency. And your healthcare provider, your nurse, is really able to share how you can best prepare. And if you develop symptoms of COVID-19, contact your healthcare provider right away. As far as medications, we all know you don't want to stop taking medicines or change them without first talking to your nephrologist or your nephrology team. But, a few little tips is ask for getting a larger supplier medication, such as for 90 days, so you don't have to go to the pharmacy as often. And talk to your pharmacist. See if you can schedule all of your prescription refills to happen at the same time. I recently was getting refills and realized I was getting them, one day, and then the next day, and having to go back and forth. And so it was a good tip for me as well. Calling your prescription orders ahead of time, especially if you live in an area where you have access to curb service, drive-in, or even mail order. And if you do visit your pharmacy in person, take the same precautions you would for in-person clinic visits. Many just a good routine to have to take those precautions. Build your health literacy, and here, like to talk about how to become a better health advocate for yourself. So ask questions. As a nurse, I can tell you that if a patient, asks, not only ask questions about your condition, but if a patient says to me, "Are you sure about that? That did you?" I don't think, that's what the doctor told me last. I've learned over years that that's really kind of saved me. I go back and ask, and often the patient who is the health advocate, it was correct. Don't walk away in the dark. So when you're at the end of a visit, or if you feel like you've received a lot of information, check in and say something like, "Let me see if I understand this," and then share what your understanding was. Be your own pharmacist, whether you bring your medicines to your clinic visit um, once a month, or whenever you see your nephrologist. I think it can be helpful sometimes with all of the medications, you know, out in front. We healthcare providers, often see a lot of clarity about whether or not a medicine reacts with another medicine, or just how many medicines you're taking, and can they be pared down in a way that helps you with your routine. Tell the truth. And what I'm saying here is, if you're asked about exercise, or I think, one of the things we frequently hear is if you're at the dentist about flossing. But if you are able to trust your provider, um, you want to get someone who you absolutely can trust and to tell the truth. Bring someone with you. Whenever I go to visits, I always take my son with me, and he can either reinforce, what I remember that I heard, or remind me. Know your medical history. I know some patients and their families actually, carry a medical history around with them. Right now, we have smartphones, and you can detail that medical history on your phone. And then tell the healthcare team if you need an interpreter. Everyone is it's right that you have, and so don't feel awkward about asking for an interpreter. Helping in a crisis. Well, we've all since 2019 and today, we've had a few years of a different kind of a crisis. And so one of the things I want to really reinforce is to seek trustworthy information. There's a lot of information out there, and it is really very easy to get misinformation. And so seek trustworthy information. It's another thing that your nephrologist or your nephrology nurse can help you sort out. Use agreed upon communication methods. So if your team has asked you to communicate within um, a medical record, if that's something that you have access to, it can be very, very helpful. Um, and then everyone viewing or experiencing or leading during a crisis interprets it through a unique lens. So there isn't one of us that will have a comprehensive, accurate picture. Try to look at it from other points of view for understanding. And here's an example. These are from the CDC website, and it's, there are myth busters. And so you can find out about COVID-19 myths and see the facts. And here's another one. But there are many of them. And that's a good resource you can see comes from the National Foundation for Infectious Diseases. So I want to talk a little bit about self-dialysis as self-empowerment. It is a really good time for self-dialysis. Whenever I started in nephrology back in the 80s, um, home therapies were not as well sorted out as they are today. We have a lot of assist devices and things, thankfully, are becoming more simple in terms of operation. But it is a really good time. There's an emphasis on self care for people who need dialysis. And so um, we have decades of experience now, and your nephrology team really wants to put more people on a therapy where they can offer self-care. And there are special units to teach self-care inside of the dialysis clinic and then transition to home. But even if don't have access to one of those units, your dialysis facility can certainly, they're capable of accommodating that. Outcomes are good. We know that people who take care of themselves at home have fewer hospitalizations and basically really do well. It also helps prevent medical errors. If you've had any exposure in healthcare, you know that there are accidental errors that happen because we're all human. But whenever you're taking care of yourself, it really does help to prevent medical errors. And what, whether or not how aware you are of your care. Find out which home therapies will work for your clinical condition and lifestyle, and advocate for yourself. Start at the very beginning. Weights, temperature, listening to your heart, um, holding needle sites, self-injection. I'm going to disclose that I recently was hospitalized twice for 3 weeks at a time, and my first discharge, as a nurse, I was like, well, I'll be going home with, Lovenox, which is a blood thinner. And I was like, and so, I had the realization, like, who's going to give me that? Because it was not self-administered in the hospital. And I learned to do that. And, I felt better about being able to do my care, and but had that moment where I learned about what it felt like to take on something, and then how I felt after I was able to do it. And now I want to talk a little bit about, this is something that is not unfamiliar to people who have chronic kidney disease, but about what disabilities look like. And some look like, as you can see, it appears as if there is no disability. And I want to point out that COVID-19 has really taken a toll on nurses and physicians, um, also technicians and support personnel, but from a mental health point of view. So, your care provider may also be someone who's suffering from that. So, how do we support the healthcare worker in your life? First of all, tell them how much you appreciate them. Follow CDC guidelines and state protocols. Um, be a good listener. Respect their need for distance, whether it's emotional or physical. We don't know what others have gone through that day. Be understanding. This is one that I almost didn't put in, but ask what would be helpful. Donate food or other supplies to their workplace. There's times where it's appropriate, but definitely ask. So ask again how you can help. And then finally, take care of yourself. oh, sorry, I have one more slide. And then 4 ways to keep cool. And this is from a great book called The Prepared Leader. Envision presently, take the situation one day at a time and concentrate on the positive. It's really easy for us all to get caught up in bad ideas, negative words, but avoid negative individuals and those things, and constantly think positive ideas that you can achieve whatever you're working towards. Get rooted. There was a lot by the speaker prior about relaxation methods, meditation, and deep breathing, and lots and lots of great recommendations by him. And then organize and concentrate, manage your time and your priorities, and so that you can take care of yourself. And that is my final slide. Are there questions? Lori?
Do we have any questions from anyone? I have a couple of questions
Sure.
because maybe you could give some ideas, because when we're really frustrated, and these are some things that I do is I tell myself little mental things, like, because I get mad when I don't feel like I get being paid attention to or something like that. If I'm in, I'm just going to add my spotlight. So, like, for instance, when I was in the hospital, and one of the areas of contention is pain medicine. And I lose my patience sometimes because the nurse who's coming in is not able to prescribe something for me. She's trying to get a hold of the doctor, right?
Mm-hmm.
And it's so crazy, but I had to learn some like meditation techniques to try to get me when I was in severe pain, because as you know, when you're a long-term kidney survivor, your pain tolerance is higher. I'm like, that little Tylenol doesn't work for me anymore. And some strategies to communicate with yourself. Like, I'm like, if I'm having a discussion with somebody and it's a little bit challenging, I tell myself, okay, I'd rather be happy than right. Do you have any little messages that you mentioned?
Well, figure out who is advocating with you on the team. I mean, I think we've all been in that situation where, as you said, if there's someone bound to be on the other side of any discussion, don't partner with them, first of all. But I, as I said, I had an orthopedic injury, and I was in the hospital, and I thought of all kind, I went through that real anger, like, it's not right. I'm a nurse. I know what they're supposed to do. I mean, my goodness, how can this be? And, really, really, really frustrated. But, then stood back and went, okay, wait a minute, asking them about, things like I asked, like, can we bundle my care on this shift? I mean, how's staffing, and people would, say, oh gosh, I have, you're one of 6 patients and you're the easiest. And I'd be like,
I'm the easiest.
Get out of freaking bed without help. What do you mean I'm the easiest? It's just so, but then, like, okay, well, what could I do? Right. And I had a similar pain issue. I can't take a number of drugs, like many of you. And I had a nickel for every time they were offered, the ones I couldn't take. I mean, not the ones I could, but the ones I couldn't take. There were, they were very generous. So trying to figure out who I could contact on the team, because like Lori said, you're talking to a nurse practitioner and they're like, well, I can't prescribe that. I mean, they're with you, but they're like, but I can't write for an opioid. And so figuring out when and where to advocate and how to have those conversations. And I was able to do that, but it took a lot of strategic work on my part. I mean, I really had to think it through about, okay, now who am I going to talk to? When is this doctor going to come by? I had a surgeon who believed only in over-the-counter medication. So, can I tell you?
Is that Frankenstein?
What choice words I thought of. But being on the other side of healthcare can be really, really frustrating. But I spent a lot of time saying, what's your staffing look like? What are you doing? How can I work with you? And then just trying to figure it out.
Figure it out, like just even asking, when is it a slow time?
That's
like if
right.
I'm in the hospital and I want some help taking a shower or something, you can ask, when is a slow time that I can call upon you?
That's right.
To
and
help
avoid
me.
shift change.
And,
I'll
yeah,
be
it
darned
seems
if
like
I
it's
didn't have
always
to
a
go to the
shift
bathroom during shift change. And so I had to teach myself, okay, I know I'm a nurse. I know whenever shift changes, that's like a nightmare for patients to call during shift change. Okay, it is a freaking nightmare. Now you would go, okay, well, there's twice as many people there. Like if you're a patient, you're thinking, well, there's the night shift and the day shift. How tough is it? Well, there are so many handoffs that really require, people paying attention, that I had to teach myself. It's like your mother or your parents said to you, I don't care if you don't have to go to the bathroom. We're leaving on a trip. Go to the bathroom. Okay. And then sure enough, you eke out, more than you thought you had. And what I would do is I would go, okay, I set my clock for, I am going to go to the bathroom an hour before shift change. So it's little things like that you can do to be helpful.
Exactly. Well, and Suzette, I don't know if you can cue a picture for, we can pull you up, but this last couple of years, I think we all need to just give a shout out to all the healthcare professionals out there, because, number one, they're risking their lives because we had this major pandemic. And sadly, I know some healthcare professionals that passed away from it. And we created this little PIN program because of the fact we wanted people, caregivers, to know that they made a difference. So all of these are on our website, and they're $15. We mail it to you. And it's a little thank you of like a sunflower. You are my sunshine. You give me hope and make me feel at peace. So, just different little things, little hummingbird. And
these are so fantastic. And Lori, can I tell you that when I was in the hospital, my last 4 months of 6 weeks of hospitalization, that I saw on the badges of nurses these kinds of pins. I mean, something that a patient gave to them that really, was uplifting, made them feel better. And so, it's one of those things that keeps on giving. Right?
Exactly.
I mean, it's wonderful that when you first receive it, but you'll see that these, healthcare workers, wear them on a lapel, wear them, attach them to their badge. And then, someone like me, I'm like, wow, look at that. Then I ask, well, who gave you that? And, this is a great offering.
Well, we just did this because there's a healthcare shortage and we want people not to leave. And so I was thinking about that, and I've given some to my healthcare team, and I gave one to my gynecologist, and he's this old gruff, I mean, it's hysterical, but he's an oncologist gynecologist. And as you know, having a transplant, I'm highly susceptible to gynecological cancers, which I have been battling for 25 years and has never gotten me. I have to tell you, but this doctor, he came, and I love to tell this story because when I first met him, I was referred to him after I had a hysterectomy. And they're like, she's, very much at risk. So he's interviewing me because he's the best. And I had to actually get his buy-in to even take me on. And at the end of the meeting, he said, you know what, Lori, I'll take you. But you need to promise me if you never miss an appointment, I promise you'll never get cancer. And it was a total God syndrome. And I will take that God syndrome when I'm like, he was so confident that if I just kept my appointments, he could keep me cancer free. And I've been going to him for over 12 years. And I go in the office and I see people who are not surviving. You can just tell it's really difficult. And sometimes I have to wait for him for 2 or 3 hours because he's helping other patients and it's 8 o'clock at night till he sees me. But he's not at home with his family. He's there seeing patients. And we have to remember that, guys. When doctors and nurses are calling you late at night, I had somebody complain, the doctor texted me at 11 o'clock at night. Wow, I want that doctor, because he's doing everything he can do to care for you and get you the information you needed. And so I gave him the little pin and he just started to tear up because when you're dealing with a difficult illness, you sometimes just see, you don't feel like you're really appreciated. And I think we need to give more appreciation for the time spent. Yes, they get a paycheck, but this is their calling. I've heard people, well, they get paid. Well, you know what? Healthcare is more than a paycheck. People do it because they love to do it and they love to care for people. So everybody, I encourage you to just, this holiday season, go in, send a little note or a card and just say give them one of those little kisses, chocolate kiss with pinned to a card. Thank you for making me feel better or being nice, because people never forget how you make them feel. And we know that when we don't feel heard, but also healthcare professionals are, they're so busy. And for people on dialysis, they have to have a certain minimum staff to be able to even put people on dialysis. So if the nurse's child is sick or something like that, they have to get another nurse in there. And that nurse may be like, oh my God, I'm really tired today. But, they're coming to work because that's the nature of this business, is that it's 24/7. It's a chronic illness and people need the care. So I'll stop there, but any questions for Helen before we wrap up?
Really never stop advocating for yourself.
Exactly.
It was, Lori talks about advocacy when it's, legislation. There's a lot of crossover skills. If you get to participate in something like that, you learn how to advocate. But, sometimes it's easier for you to advocate for, someone you love, like a child or a parent.
Right.
And one of the things that's hardest is advocating for yourself and how to do that. And to do it effectively, but be strategic. There are ways around just about anything. So,
well, what I would like to suggest to everybody, we've got our next speaker coming up in a couple minutes. I'd like everybody just to take a 5-minute break real quick. And a shout out to our corporate mission partners for making this happen.